Good evening, everyone, and welcome. Glad to have you with us this evening. Going to talk about some startling stats and an important issue. Today, there are more than 15 million people in the U.S. that have been infected with the coronavirus, including 520 folks living right here, 520,000 folks living right here in the Buckeye State. 7,187 fellow Ohioans have died from the coronavirus. As you can see, cases are spiking across the U.S., including here in Ohio, leading to dire warnings about hospitals filling to capacity, exhausted healthcare workers, and expanding lockdowns. Now, if I were in my TV studio, I'd be reading from a teleprompter. Because I'm at home, like many of us, I'm reading from my iPad, so I ask your forgiveness and understanding of that. As we enter the winter months, it is predicted conditions will only get worse, which has led to more government restrictions, including an expanded curfew by Governor Mike DeWine until the 2nd of January, 2021. All that's affecting businesses, schools, our economy, and our households. What we do to stay safe through the COVID-19 pandemic is important. The answers of how well we follow the prescriptions will determine how many of us will live or how many of us will die. Welcome to the Black Professionals Association Charitable Foundation, the Professional Development Forum COVID-19 Part 2 on health, business, and education. I'm Harry Boomer, anchor and senior reporter at 19 News and the host of CW 43 Focus. I will serve as your moderator today for what is going to be an important and informative discussion about COVID-19. Let me introduce our exciting panel. Many of them you already know. We have with us Dr. Charles Maudlin, a surgeon, director of minority health at the Cleveland Clinic. Dr. Maudlin is the first African-American urologist in the history of the Cleveland Clinic and is one of approximately 20 Black transplant surgeons in the nation. He is a member of both the Ohio Commission on Minority Health and Governor Mike DeWine's COVID Special Minority Strike Force. It is important to note that Dr. Maudlin shares the prestigious BPACF Black Professional of the Year recognition from 2015. Hello, Dr. Maudlin. Up next, Andrew Jackson, President and CEO of Ellison's International, a full-service manufacturer and distributor of corrugated packaging. Mr. Jackson also owns several other businesses and is owner and CFO of Mac Installations and Consulting LLC, a low-voltage telecommunications company. He's owner, operator of AJ Automotive Group, DeWine Landscaping, Snow Plowing, and Forest Glen Properties. Good to have you. Now, prior to his entrepreneurial engagements, Mr. Jackson spent almost 30 years in corporate America as a partner with the global consulting firm Accenture. He, too, was appointed to Governor Mike DeWine's COVID Special Minority Strike Force. Ms. June Taylor is with us also. She is the Chief Performance and Strategy at the Western Reserve Agency on Aging. Now, she has over 20 years helping companies improve their strategic operations and performance. June Taylor has held executive positions in operations, business strategy, and human resources. Prior to joining the Western Reserve Area on Aging, Ms. Taylor was president of Mac Installations here in Cleveland. She started her career in engineering with Briggs & Stratton and the Ace Hardware Corporation. She is the third member of the Learned panel to be a part of Governor Mike DeWine's COVID Special Minority Strike Force. June, good to see you, and thank you for joining us. Last but not least, we have Bill Edwards, a retired Cleveland police officer with 28 years of service with CPD. Now, he's the executive director and editor for the historic Call-In Post, Ohio's largest Black newspaper. He is also the general manager for radio stations WABQ and WKTX. As an ordained minister, Dell operates by faith and strongly believes in the statement, each one, teach one. Welcome to each of you. With the exposure of this panel I've just introduced, including 3 appointees to the Governor DeWine's Minority Strike Force, you can see why this is going to be an informative and exciting panel discussion. Now, before we get into that discussion, I'd like to remind our viewers we will dedicate the last half hour responding to your questions. So start submitting your questions in the comment sections. You'll see that off to your right. Now, early in the year, BPACF held a forum on COVID-19. A lot has happened since then, as you well know. Before we really delve into the topic, I'd like each of our panelists to briefly tell us why we need part 2 of COVID-19. Let's start with Dr. Maudlin, followed by Andrew Jackson. Dr. Maudlin, the screen is all yours.
Yeah, thanks, Harry. It's my privilege and pleasure to be on this panel with all of these distinguished guests, and it's always nice to work with you, Harry, and I really appreciate the BPACF for putting on this forum. There are several reasons why I think it's important that we have a part 2 from what we held several months ago. I mean, this coronavirus is a new virus, and we're learning a lot about it as we move on. So what we knew several months ago when we had the first forum, we know so much more now. And also knocking on our doors, the first COVID-19 vaccine that is going to become available. And we need to educate the community about the fact that the vaccine is available, and that we encourage the community to seriously consider actually getting the vaccine. There have been a lot of surveys nationally, locally. I've taken my own surveys and seen patients that I see on a daily basis. And what I'm seeing that is very disturbing is that a number of African Americans, actually less than 50% of African Americans surveyed, actually indicate a willingness to take the COVID vaccine. So I think it's very important that that be on the agenda, part of the discussion of the panel this evening.
All right, sir. Thank you very much. I appreciate that. Andrew Jackson, you're up next.
Harry, thanks for the introduction. First, I want to say that I'm glad we're having this session as an African American. I come from humble beginnings, born and raised in the inner city of Cleveland. And I think that I'm trying to avoid us as African Americans being non-existent in our community. And as an African American male, we're supposed to be the backbones of our families. And we already get taken out for so many things, incarceration rates, healthcare issues, so on and so forth. And Dr. Maudlin has been on this journey for a long time. He's always talking about healthcare and being proactive in our community. But we really need to be proactive in our community. And nothing bothers me more when I go ride down the street and see our African American males are congregating and not taking this very serious until somebody's in the hospital on a respirator and having to, fight for their lives and their family is threatened. So I think that this is important to upholding the family structure in our communities. Black males are the backbone of our family structure, and we need to make sure that we're healthy and we take this very serious. And I want to say to people that although the vaccine is here, that a vaccine is not the solution. A vaccination is the solution set. So I would encourage you not necessarily to tell you have to take it, but get educated on the vaccination and understand the repercussions of taking it and not taking it, because I think it's important that we as African Americans are around this community and don't get left out.
Thank you, sir. That's Andrew Jackson. I think that what you're saying is so important. We hope to delve deeply into that during this program, and I'll talk more about that. But first, let's get into June Taylor, and I want you to tell us why you think it's important to revisit COVID-19 a second time, June.
I believe it is really important that we take a look at having this session for a second time, because there unfortunately are many number of individuals, minorities as well as majority community, that are still engaging, Harry, in high risk behavior. What we do know is that there are certain behaviors of which, and Dr. Maudlin will cover this a little bit as well this evening, where the risk is most certainly greater. And so I see a great number of our young adults, as well as the population in general, still continuing to congregate, still not using their masks or face shields. I see them not embracing the rules that really are about personal responsibility and self-discipline. And so I think when we really talk about why we need to continue to have this conversation, the numbers show that this conversation is truly needed. The numbers are continuing to increase. And we really have to have a candid conversation about our behaviors, personal responsibility, as well as taking our health very seriously. And that includes a frank discussion about the vaccine, no doubt.
Thank you, June. I can tell you just today, listening to you talk, I was told you're going to keep it real, and you definitely are. And Andrew Jackson, both of what you just said. As I drove down my street coming home today, I drove past about 6 or 7 brothers standing there on the street. Nobody had on a mask, and it smelled as if I was driving through a pot factory. So I understand what you're saying. We really do have to find a way to make it real, because this thing is real serious and it is real deadly. Minister Dale Edwards, people have heard your name and your voice and know what you've been doing in this town for a very long time. Talk to us about COVID-19 from the perspective of why it's important to revisit this issue again here as we approach the 2021 year.
Thank you, Harry, for this opportunity. And I'd like to thank the organization and each and every one of you for allowing me to participate and for my voice to be heard. I have a personal testimony to tell about this, but I want to encourage each and every one of our stakeholders, all of the community persons that we represent, that this is definitely serious. This is a deadly disease. And if we don't take it serious, there's going to be a whole lot of people dying. We have to encourage each and every one of our stakeholders to take this vaccine. And then not only that, we need to encourage them to remember to wear the mask, wash their hands, and do social distancing. Just like Andrew said earlier, I'm in the street all the time monitoring what my drivers do. And I see the congregating. I see the people not practicing social distancing. And it's business as usual. We have to change that behavior. We have to do something about it. We have to keep doing these forums. We have to keep educating. We have to keep training our people that this is about lives. This is about our children's lives. And we have to really take this pandemic serious. Thank you.
I raised my hand in talking about this because it is so important that we do take this pandemic seriously. Myself, I lost a nephew 2 weeks ago to COVID-19. He had some of those comorbidity issues health-wise that probably exacerbated his condition and caused him to leave this planet and his family way too soon. And as we've all have seen and talked about so far on this panel discussion, so many of our people are not taking it seriously. And that is why so many of us are getting sick and why so many of us are dying. We got to understand we can't take this back to Big Mama's house. Now, surprisingly, there are still some people who don't believe this thing is real. I think it's just like the flu. We've heard that from our national leadership. We think that it is a political scam. Many say that it is just not one of those things that we should take seriously. And as all of us can testify, and so many listening and watching can also testify, this is so very important. Dr. Maudlin, tell us about your role on the governor's special COVID-19 Minority Strike Force and some of the recommendations that have been formulated. As a physician, what you would like to highlight on this forum for the community's best interest.
Muted.
Yeah, thanks. Sorry. So it's easier to do surgery than operate this technology sometimes.
We understand.
But I saw in the privacy of my exam room and speaking to patients going back February, early March, the Black community, many actually would laugh and say, well, COVID doesn't affect us. We are immune to getting this COVID-19 vaccine as African Americans. Then we quickly learned that that wasn't the case. And the governor, and I give him all the credit in the world for this, Governor DeWine, in looking at the data, we realized that African Americans in some locations had up to 5 times greater incidence of not only acquiring the COVID virus, but also dying from the COVID virus. At one point in Chicago, we saw that 70% of all of the mortalities in Chicago were in African Americans. And so in recognizing these disparate incidents of COVID and morbidity and mortality from COVID, the governor, Mike DeWine, actually formed this special COVID-19 minority strike force. And it's my privilege to have been able to serve on that strike force. I actually headed up the Education, Communications, and Outreach subcommittee. And our task was to develop strategic and focus initiatives to educate the Black community, people of color, communities of color, about what is COVID and ways in which to better mitigate against acquiring COVID. How can we, as people of color, protect ourselves, our families, and our communities? And so we set out to develop specific messages from individuals, people of color, individuals, physicians, and others delivering these directed messages to the Black community. You know, one size fits all messaging doesn't necessarily resonate with everybody. And so we set out to educate the community about what is COVID, how you can better mitigate social distancing, wearing masks, staying at home whenever possible, hand washing. And that was one of the major initiatives that came out of our committee. Another major initiative or result of our subcommittee and the strike force in general that I'm very proud of. And we presented these final recommendations to Governor DeWine, which he accepted and he's implemented these recommendations, 34 recommendations, was that this is more than just about a COVID-19 or the coronavirus. This is about healthcare disparities. And if we're going to actually not experience similar circumstances, you know, during another infectious, condition or pandemic, we have to actually recognize that African Americans are more susceptible to getting and dying from the COVID pandemic because of the underlying conditions that you mentioned, Harry, that we experience higher rates of diabetes, hypertension, heart disease, kidney disease. These conditions are chronic conditions that lower our immune system and make us more susceptible, not only to influenza, the COVID virus, but are going to make us more susceptible to a future pandemic. And so Governor Mike DeWine, he took these recommendations, and at a press conference, he said that as long as he is governor, he's going to sustain these efforts, not only to fight the COVID-19 pandemic, but to address these rampant racial and ethnic healthcare disparities that disproportionately afflict people of color. A lot of these healthcare disparities are a result of what we call social determinants of health. So I think that was I'm really proud of the work that the strike force did, our subcommittee, the strike force at large, the leadership of the strike force. And I'm really proud that the governor actually took our recommendations and recognizes that we actually have to focus on eliminating these social determinants of health.
Dr. Maudlin, thank you for serving on that panel, as well as to Mr. Jackson and June Taylor, the other two on this panel who were on that. Shows you how important Cleveland is when it comes to influence and educating folk about all these issues that we talk about, the comorbidity things, the health disparities and all of that. Mr. Jackson, you are in a very unique position as a business owner to talk about the effects of COVID-19, the economy and business, how it affects both employer and employee. Talk to us some about, from your perspective, why we need to talk about this day in and day out to everybody we know.
Yes, I have a manufacturing business over on the east side of Cleveland in the Collinwood area. And, oftentimes people ask, are you a minority business? And I try to tell people that we're a good business enterprise, not a minority business enterprise. But you can't help but accept the fact that I have a majority of my people in my plant are African-American males. And one of the things you have to worry about, first of all, is are you going to have jobs for them in the community? Because when COVID-19 came, when they say it, they say that if a majority business had a common cold, a minority business had the whooping cough. And so it's always worse for minority business because there aren't that many minority businesses, particularly second generation minority businesses in our community. And so the first thing you have to worry about is, are the orders going to keep coming? And given where we were fortunate that we were sort of in the PPE space because we make corrugated boxes. So PPE clients of ours were increasing their volume, but other industries took a big hit. Automotive took a hit. Housing took a hit. Entertainment took a hit. So if you were in a restaurant business, of course, or the hospitality business, or the hotel business, or the transportation business, you took a hit. And so we first had to protect our employees and make sure that they knew that we were going to do everything to help them get through the crisis. And that at our company, you're just not an employee, but your family. And June can attest to that because she's part of our business model over here with our other business, which is Mac Installations. But the corrugated business was the one that I was worried about. And the concern you have is that, to Dell's point and the doctor's point and everybody's point, is that we have to really practice social responsibility. And my concern was that although I have a team who works here in the plant, a first shift sometimes and a second shift if we need it, they're with me for 8 to 12 hours maybe, but they still have another 12 hours where they're off doing what they do. And so you really have to analyze each of your employees and ask yourself, are they following the rules? Are they doing the things that they need to do to be healthy? And they come into your facility so taking temperature was very important to us and giving people all the protective equipment they needed to be safe in our plant. But you have to constantly remind the employees that while you're here, you're safe, but you have to be safe when you leave. And so they walk in the building and you say, I wonder if this guy actually is doing what he should do at home. Is he washing his hands and keeping his hands clean? Or are they making sure that they are wearing a mask when they're home? And one of the things that I find particularly important in our community for us that I try to tell people is you have to practice 4 or 5 important things as an African-American male in particular. And one is that, and I go past the liquor stores, and I'm not trying to put liquor stores out of business in Cleveland because Lord knows they are in business. And when you drive past the state liquor stores, the parking lots are packed, particularly on Thursday and Friday and Saturday, and the weekend begins. And I'm not saying to people that everything is good for you in moderation, but we should reduce our alcohol consumption as much as we can, particularly because we're susceptible to all the other things that we have going on with high blood pressure and diabetes and things of that nature. Also, we should try to cut back on smoking because, that's not good for the heart. But eating well is important as well. And, I grew up in an environment where my dad, if you came home and you didn't get the big piece of chicken before he got it, you didn't eat. Or if you ran out of food, you had to go to McDonald's. And that was a delicacy for us to go to McDonald's. But we have to cut back on the high fatty stuff and eat more vegetables and fruits and cook the food and, cholesterol and not low cholesterol things like olive oil and things of that nature, because you can still eating healthy does not mean you can't eat good food. It just means that you're not eating fast food and going to rallies and getting a Rally's burger that's high in sodium and things of that nature. And the last thing, though, is because we're very susceptible, and I'm sure if I could, Dr. Maudlin would be cheering right now, but we have to go see our medical practitioners when we should. We grew up in a household where my dad was an hourly worker. He couldn't take off work because he didn't have, salary. And so he had to cut his hours when he went to the doctor. So, he was like, I'm going to take some Robitussin and some Geritol, and I'm going to take a Doan's pill, and we're going to keep moving. But we have some great facilities in our town here in Cleveland. We have Cleveland Clinic, Metro Hospital, and Dr. Maudlin. I got to give a shout out to the other hospitals. But we have some great healthcare facilities here with Metro and University Hospitals and Cleveland Clinic and some of the small satellite facilities here. But we should take advantage of those programs. But in order to do that, the most important thing is you have to have a job that has some good healthcare benefits, because if you go there without healthcare, then you get treated accordingly. So I think we should really pay attention to what the COVID-19 people are saying to us. And it's particularly important to me because the last thing I want is an outbreak and a super spread situation in my facility and have to shut down. And more importantly, I have to shut down jobs, and people don't have the ability to feed their families and get benefit and live good lives.
So there is a part of the national conversation right now that's holding up some relief for folks who are unemployed and folks who need money. And that is what Mitch McConnell is pushing. And that is some way to sort of shield employers in case someone who works for them gets sick with COVID-19 as a consequence of having to come back to work. Your thoughts on that? I know you're an employer and you care about your people, but that also puts you at a particular risk. Talk briefly, if you could, about that aspect of this whole discussion.
Well, the thing you worry about is an employee trying to come back too soon. And, you hear people say, oh, I have a call for, I don't feel too bad. But you really have to be very strategic in this process, because although you need that employee to be on the line, you want them to come back as fast as possible. You have too many other people at risk, and so you don't want to spread it. And so if an employer is going to help, if there's some relief for that, that's great, because it allows us to keep rolling and also keep the employees safe, because if you don't work, you don't eat, and people are going to try to come back to work, which may not be a great thing for you if you're not well.
That's a very good point, and thank you for making it. June, you deal with a very special part of our community in your work with the Western Reserve area on aging. The elderly is among the sickest and is most likely to get sick and die from COVID-19. We see how many numbers are increase in nursing homes and other places among the elderly. Is the Black community overall doing what it should be doing to protect itself and others when it comes to the coronavirus? And on our behaviors, what do we need to actually do? We've talked some about that, but get a little more specific. Get into the weeds on this about protecting the elderly and then others taking responsibilities for themselves and their families.
Sure, Harry, that's an excellent question. And I would like for us to take a look at the first slide, which is to be informed and know your risks. I believe the number is approximately 76% of the COVID-19 deaths that have occurred in our facilities, nursing home facilities, where the elderly are. And what's essentially happening there is, unfortunately, it's due to the workers. So what we are stressing, and why this session tonight is so key, is if you look at the high risks behaviors, it's going to a bar, going to a gym, going to sports events with families and so forth. So we're seeing really now the numbers increase since Thanksgiving. And these numbers are also the same numbers that are affecting our seniors, because these individuals have been going to work and then they're transmitting, unfortunately and tragically, they're transmitting the COVID-19 virus into these employers. And so then that's why you're seeing, from a legal perspective, employers saying, it's not us, we're doing everything on our part, but unfortunately, this is being brought in by your employees. The second point I wanted to mention, Harry, is that our seniors are in grave danger because the social isolation piece is taking a toll like never before. This is the greatest period in our lifetime and in this country where we have had to have a discipline that has never really been exhibited before. And so from a personal responsibility piece, to answer your question, many people in these communities are struggling with saying, no, I can't visit you. No, you can't visit me, because that's just not the natural form of our lives. And so our seniors are the ones who are most at risk due to their existing health conditions, combined with the psychological component and isolation, and then also being unfortunately in these living conditions, which right now are just not optimal. I hope that answers your question.
It does indeed. And I like to also say that, we say we love our parents and grandparents and the elderly. We have to show that. And unfortunately, the best way now, I believe, according to the science, to show that is to stay away. As hard as it is to stay away, because they find themselves, or we put them at greater risk. And that brings the question, June and Del, I'm going to come back to you briefly. And that is, are we part of the solution or part of the problem? And if we're part of the problem, how do we become part of the solution? June?
Well, thank you for calling on me first, Harry, but I will say this. I will say that I think it's both. We are part of the problem in that many of us, and I think Dr. Maudlin and I think Mr. Jackson would agree, and Dale, we don't want to say no to our loved ones. That's an unnatural state of being. And secondly, we're part of the solution by doing, and let me just name two characteristics that I think is often forgot about with regard to the whole hygiene routine. One, leaving your shoes that you are wearing out in the daily part of your day, leaving those shoes outdoors, perhaps in your garage or perhaps on your porch, and then stepping into your home and washing the clothes that you have worn that day and been outside with. There's a lot of discussion, and Dr. Maudlin, I know, can emphasize this more, about the airborne components of the droplets. I think that being part of the solution, the shoes component, I think also making certain that we wash our outside clothes. And I think also the last piece of recommendation that I would do is don't forget the air filtration piece in our homes. Every 6 to 8 weeks now, it's being recommended that we change that air filter. You're not hearing that as often as some of the other rules of hand washing and so forth. But I would really encourage people to contact their HVAC professional and make certain that they are in fact changing their filter or using a HEPA filter in their residence as well. That's key too. Fresh air, airflow, and clean air.
Thank you very much. I have to tell you, I've become somewhat a fanatic when it comes to trying staying alive. There is no guarantee that COVID won't get me or anybody else. But just yesterday, I bought and put in my house an air filter with HEPA filter that has a UVC light that circulates the air and kills the bacteria and the viruses that I may bring in from having been out talking to people all day. So I really understand. And Dale, you mentioned earlier, and I don't think you expounded on it, but I'd like for you to. You said you have a personal story you'd like to share. Can you get more into that? Because I think from what I understand, it is impactful and important that people know that COVID-19 is real.
Thank you again, Harry, for this opportunity. I'd like to publicly and personally thank Dr. Maudlin and for him being a friend and a person that I could reach out to in my time of need. Also, I'd like to thank the Cleveland Clinic Hospital and all of the wonderful things they did for me and my family. And I'd like to say that we've been practicing social distancing, myself, my family, all of the people that work for me. We've been talking about it. We've been telling everyone that would listen that this pandemic is serious business, and this is just a serious time in each and every one of our lives. And for me, this happened probably in October. Around the early part of my October, my daughter came down ill and I had to take her to the hospital. And in taking her to the hospital, she had a lung infection. She couldn't breathe. And while there, they gave her the test and it came back positive that she had COVID. And it got progressively worse. You know, I'm going to kind of shorten it, but that does not shorten the seriousness of what occurred. And basically, she wound up being on a ventilator. But prior to that, they tried to put her on her stomach so that she could breathe. And the nurse stayed there and she held her hand. They cried together. And people got to understand the importance of what's going on. You know, the pandemic is not just wearing the mask, washing our hands, and social distancing. But when a person becomes ill, we're not able to be there. There's no family support. And so it's the people on the front line, those doctors, those nurses who have to stand there and be that family member, that care person who's supporting our family member. And that occurred with my daughter. And my daughter told me it was because of this nurse who stayed there with her, held her hand, cried with her, who helped pull her through. But subsequently, she wound up going on a ventilator. But prior to that, I was able to call Dr. Maudlin, and I'm so thankful that he took my call and he gave me a lot of valuable information, what allowed us to make that decision. You know, it was a time when a person would go on a ventilator, we would write them off. And if you looked at the statistics, you can see that 2 to 4 people out of 10 are able to come off of that ventilator. But through the prayers of all of the people in the community who we cherish, and again, the work of the people at the clinic, my daughter was able to go on that ventilator, stay on it for approximately 10 to 12 days, and through the grace of God, she came off of it and she's recovering. And I want to tell people that it's a process that you have to go through. So it's not like that if you get this disease, it's not like the flu, it's not like a common cold where it lasts maybe a week, 10 days, and then you go back to normal. No, this is a process and it can take months and months for you to get back to what you could consider normal, and then that's not normal. She came home recently from rehab. She has oxygen. She's using that. But I'm just encouraging each and everybody to really take this serious. It can happen to anybody. It can happen to you. It can happen to your loved ones, and it will if you don't take some precautions. And I want to encourage everybody. It's like when we were coming up, they gave us a cube with sugar, and in that sugar, it was the vaccine for polio. And there was skepticism back then, but we have to realize that if there's a vaccine, we have to be on the front line taking it, not the back line taking it. You don't want to be at the back of the line. You want to be at the front of the line, getting all the help that you can possibly get so that we can live. This is about living and not dying.
Absolutely, Dylan. Thank you so much for that and for that personal story. I hope it hit home in people's heads and hearts so they understand that COVID-19 is real. Wearing a MAGA hat is not going to save you. Putting on a mask, washing your hands, social distancing, those kinds of things. The things that we've been talking about time and time again will be the things that'll get you through. And don't forget, even when the vaccines, and we're going to talk about that next, even when the vaccines are here and we get them, we still got to wear those masks and do the same things, because it ain't over till it's over. And it's a long ways, ladies and gentlemen, from being over. Before we get into the vaccine discussion, and that's a very important one, I want to encourage you to go to our chat room and to begin to formulate your questions there. We're going to try and answer as many of those as we possibly can. Try to make them questions and not prolonged statements, because we want to get as many questions asked and as many answers as we can. So please go to the chat room and begin to ask your questions there. If you make a statement, please make it brief so we can read it and all of that. I want to talk about the upcoming vaccines. They've been mentioned a couple of times throughout this conversation. There are 3 vaccines on the way, one from Pfizer, Moderna, and AstraZeneca. The first is expected to be here in just a few days on December 15th. What should we know about these vaccines? And Dr. Maudlin, I'm going to go to you first. And are they safe from what we now know? Dr. Maudlin.
Yeah, thanks. So one point I want to make is when somebody is infected with the COVID-19 coronavirus, your body will develop what we call innate antibodies, which will protect you from getting reinfected. Actually, those antibodies actually fight the invading virus and help eliminate the virus from your body. However, you're not Superman or Superwoman. As Harry just said, you still have to practice social distancing, wearing a mask, because there actually have been cases of individuals getting reinfected. Individuals who have already been infected can actually get reinfected. We don't know yet how long those innate antibodies that you develop once you get infected are actually going to persist in your system and allow you to continue to have that immunity. So it's important that you still take those precautions. Historically, African Americans have been less likely or less willing to receive even the flu vaccine and other vaccines. Even we've seen situations where certain parents don't want to immunize their children. Immunizations that are required for these children to go to public school, for example. There's been research that shows only about 30% of African Americans actually receive the annual flu vaccine. There are some places of employment that actually require individuals to receive the vaccine unless they have a severe reaction to that. Again, there have been surveys across the country showing that approximately only 30% or 40% of African Americans, compared to close to 60 or 70% of Hispanics and white Americans, are actually willing to take the coronavirus, the COVID-19 virus vaccine. And it's important that we, the healthcare providers, recognize and communicate to the community that we know why a lot of those suspicions and reticence of taking these vaccines exist. A lot of it goes back to a time point before any of us were born, the historic Tuskegee syphilis experiment. We've all heard about that. We don't want our grievances of the past to interfere with our ability to stay safe now. And since that Tuskegee syphilis experiment, there have been so many different safeguards put into clinical trials, to where we need more African Americans to participate. There are so many more safeguards that go into, immunizing individuals, development of pharmaceutical medications with the FDA, the NIH. There's so many governmental regulatory bodies that Tuskegee syphilis experiment, that's not going to happen again, to where it should actually interfere with our willingness to get the vaccine. I've heard some rumors that many individuals think that the government is going to put gene chips into these vaccines, or GPS chips, and then that these vaccines have been produced to eradicate the Black community. This COVID pandemic is a real phenomenon. There's an article that I just read, and I've seen it in different research articles. The most glaring statistic is 1 in 1,000 Black Americans have already died in this pandemic. The overall data shows that Blacks are dying at twice the rate of whites. I mean, I'll repeat that again. That's remarkable. 1 in 1,000 Black Americans have already died from the COVID-19 pandemic. So, as Harry said, just right around the corner, we have the Pfizer vaccine that is actually going to be coming out. It's going to be distributed to all states. Ohio is going to receive 300,000 samples. What people need to understand is that when you get this vaccine, you have to take 2 injections. The Pfizer vaccine, you have to take 1 injection, and then approximately 3 weeks later, you have to take another inoculation, another injection. There are going to be or distribution centers across the state are being set up to be able to have the state distribute the vaccine across the entire state, and then they're going to be distributed to hospitals, healthcare organizations, congregate living facilities, prisons, jails, places where people that are working on the front lines. These individuals are going to be given the vaccine first. ICU workers, doctors, nurses, respiratory therapists, EMS workers, people working in the emergency rooms, people working and living in nursing homes, for example. These are the individuals who are going to receive this vaccine first. So Ohio is going to be given 300 samples of the vaccine, but you have to take 2 injections. So that means only 150,000 individuals initially will be able to receive the vaccine. Those 150,000 individuals are going to be divided through the 3 different zones of Ohio: the Cincinnati zone, Columbus zone, and Cleveland zone. That means only 50,000 units are actually going to be, or 50,000 people are going to have access to that first round of the vaccine. They've compared the efficacy, the effectiveness of the Pfizer vaccine versus the Moderna vaccine. The Pfizer vaccine has been studied. It's 95%. It has 95% efficacy, and the Moderna virus also has 90 to 95% efficacy. There are different storage requirements between the 2 vaccines. They have to be put on a cold storage, and again, it's very important that we communicate to the community and individuals receiving this vaccine. If you're going to get the vaccine, you actually have to show up for that second inoculation. Otherwise, your full immune system is not going to be benefited. It takes you roughly about 10 days after you receive the vaccine to where your body is actually going to start developing these antibodies to protect you against the COVID-19 vaccine. In the studies, they have not demonstrated, there's been no person who actually has acquired the COVID-19 virus by receiving the vaccine. Pfizer actually had 43,000 people in their clinical trial. Moderna had 30,000 people in their clinical trial. There also were no deaths of anybody who actually was in the study. There were no actually severe reactions or from receiving the vaccines. There are some minimal side effects: soreness at the injection site, low-grade fever, lethargy, feeling tired. But these are not complications or what we call side effects. These symptoms are actually a good sign. It's an indication that your body is actually responding to the inoculation, to the vaccine. It's a good sign. So
that's right. That's exactly right. And many people get caught up into the idea that, I'm going to get sick if I do this. And there's a question that has been posed that I want to bring to you briefly, and that is, do we have a choice as to the Pfizer vaccine, the Moderna vaccine, or the AstraZeneca one, or do we have to take what is available in our given community? If you could briefly talk about that, then we'll move on with Andrew Jackson.
So presently, because of the short supply and the phase 1 is going to be administered to healthcare workers, people working on the front lines, we don't really know when the quote unquote community, the community at large, is actually going to be able to have access to the vaccine. We're thinking probably sometime in the spring, because they have to manufacture more of the vaccine and get it distributed, and so by that time we're going to have availability of more vaccines than just Pfizer or Moderna. So it really depends on where you go to get the vaccination, and which site has which vaccine from a particular pharmaceutical company.
Excellent. Thank you on that. One of the things that I want to talk about, and I think we've talked about it sporadically throughout this conversation, is whether or not we should take the vaccine at all. And I got to tell you, I was listening to my TV station, and I heard a local council person whom I normally agree with like 99% of the time. But he talked about the Tuskegee experiment as if it were yesterday. And his overall tone was, I ain't taking this thing because of what they did 50, 60 years ago. And I said to myself, somebody's going to die if they follow that advice. And it hurt me that somebody is as intelligent and as learned as he would make that kind of statement given this circumstance. We complain about police killing Black people. We complain about Black people killing Black people. Those are probabilities. And the greater probability now is that COVID-19 is killing more Black people than anything else. As we've already said several times during this conversation, that we are dying at a much faster rate than anybody else, Blacks and Browns in America. Mr. Jackson, your thoughts on the efficacy of these vaccines and whether or not we should look at taking them, and feel free to push back on anything that I might say in regards to how important it is to take a vaccine that is 95% effective or not to take it, because right now our lives really are hanging in the balance.
Yeah, I want to say to you that we have our company, the Corrugated Box Company, has been part of the trials for the storage of the actual vaccine. The one Moderna one has to be stored at minus 20 degrees Celsius for 120 days. And we are probably in the second of 3 trial phases to produce a corrugated box, which has styrofoam in it, which is dry ice and some phase changing materials that will allow that vaccine to get to you very safely. And having been part of that with the DLA, they are very serious about making sure that vaccine is safe and it's high quality. So I can tell you that from a firsthand perspective, it would be wonderful if we were able to be chosen as one of the vendors, but just to go through the process has enlightened me on how serious they are about making sure that vaccine is a good vaccine. So, and I am not one who takes a vaccine. I believe that you should try to stay healthy through natural processes like exercise and vitamins and things of that nature. But I think that given where we are in our community and how many people have suffered, that we should learn about the vaccine, do our homework, and be knowledgeable about it. But once you get all the facts, I think that I'll take the vaccine myself.
And given by the time it gets to most of us, there will be enough people who will have taken this vaccine so we can see the results of whether there are any kind of ill effects, or if body dies or has some kind of reaction that we normally wouldn't see otherwise in a person with his or her illnesses and or underlying health concerns. June, Miss June Taylor, talk some about how important it is to vaccinate the elderly, and because, as we mentioned before in this conversation, that is a population that is dying much, much faster than most.
Yes, Harry, that's going to be very, very important. And it's also going to be very unique. And I think Dr. Maudlin can emphasize this a little bit more. It depends on the individual and what existing conditions they already have and the environment. And that is why it's been so important for many of the elderly to be in a good psychological place, to be in a good frame of mind, as well as to be living in an environment where they are somewhat isolated from being able to contract the disease. So I think that the elderly, it's really going to be incumbent that we stay engaged on what are some of their other outstanding health issues as well. So that's the best way that I will sum that up for you.
All right. Minister Edwards, Dell Edwards, you talk to a lot of people, have for generations on the radio. When you talk to folk now, what are they saying to you about this vaccine and whether or not they're going to take it, and their concerns about the history that we all know about? You know, history is history. That's then. As Dr. Maudlin said, there are things in place now to not let that happen again. I think it's incumbent upon us to at least, as Mr. Jackson said, do our research and then maybe put in a little trust, because we know this vaccine, that this coronavirus has taken us out right and left every day and every night. What are people saying to you about this coronavirus and whether or not it's real and whether or not they're going to take the vaccine?
Well, the one thing that I've found is that people don't believe it's real. Most people believe that this is a hoax, that this is something that the government is perpetrating on the people. That is the most false conception that anyone could ever have. What we must understand as African Americans is that this disease requires a lot of care. It requires us to have the type of health insurance that allows that to happen. Personally, I can tell you with my daughter, she has to come home with oxygen. She had to come home and with a therapist and a doctor that has to visit the home. So it requires a lot of things to be in place in order for you to get the care and the service that you need. Now, when you look at it, and it's unfortunate because those that are less fortunate, those that are in low income, we're already at the bottom of the totem pole. So if we do not take this vaccine and we wait, if there's no hospital bed available for you because of all the things associated with this virus and the other things that could occur where the person have a heart attack or any number of things that occur medically that need a hospital bed, that means that we're going to be left out. So the thing about it is this, Andrew said it best, do the research. If you can't do this research, then call us, call somebody that you know so you can get all of the information and then utilize it wisely. But I encourage each and every one of you, when this vaccine becomes available, take it. I'm going to do the same, and I'm going to encourage all of my loved ones to do that because, again, I know firsthand what it requires, the amount of care, and I know that Dr. Maudlin can speak to this further because he's on the front line and he knows. And again, Dr. Maudlin, thank you. I trust you, and anybody listening to what we're saying should trust Dr. Maudlin because he's proven to be a man of integrity, stalwart, and he is truly a stakeholder who has the community at heart.
Amen to that, Dr. Dell Edwards. Dr. Maudlin, your name has been invoked, and I know you've been running the Minority Men's Health Center at the Cleveland Clinic for a long time. You've held the Minority Men's Health there for a very long time, started out with just a few people, and now thousands come well before this pandemic. In fact, you had to put off and postpone the Minority Men's Health Center Fair because of this COVID-19. So you're at a very unique position. And one of the things that comes up all the time is testing, whether or not testing is available, whether or not we should get testing. I've heard that testing is a snapshot in time. I could have gotten tested yesterday and could be infected today, and that test yesterday doesn't tell me anything about today's infection. But talk about the importance of getting tested and what we should do. Testing is not the end all. It's just one step in the direction toward being more safe. Am I not correct?
No, you're 100% correct. And I'd like to thank you, Harry and Dale. Without you, Harry, your platform to broadcast the existence of the Minority Men's Health Fair and Health Center, as well as you, Dale at Colin Post. You guys both have been monumental in terms of our success. It's very important to get tested. However, to date, even 8 months or 10 months into this pandemic, the availability of testing reagents has actually not met all of the demands. There are several different locations for pop-up testing. For instance, we're going to actually have a testing this Saturday, December the 12th, from 10 a.m. to 1 p.m. over at Stephanie Tubbs Jones Family Health Center. That's a Cleveland Clinic facility over in East Cleveland, right on Euclid Avenue. It's free. We're partnering with the Minority Strike Force, the National Guard, the NAACP. We're actually going to offer testing for people with or without symptoms, adults and children. You can just walk in, drive in, or you can pre-register. A lot of the people that have COVID actually have certain symptoms. And again, as I said before, we're learning more and more about what these symptoms are. I mean, initially we thought you had to have a fever and a cough. You don't necessarily have to have a fever and a cough. Some of the symptoms that we know now are consistent or a prolonged headache, 3 or 4 day prolonged headache, loss of sense of smell and taste. These are just some of the symptoms. And one of the reasons it's important to get tested is because then if you come back positive, and as you said, there's no guarantee the test is going to be 100% accurate. You could be negative one day, positive the next day. But if you are known positive, then you can actually self-quarantine. You can stay away from work and other individuals because you don't want to infect other individuals. So that's really underscores the importance of testing. But we do want to drive more tests and have more availability of tests out in communities of color who are more prone to developing the COVID-19 vaccine or virus.
Yeah, that's important. And thank you for that, Dr. Maudlin. One of the things that we haven't yet talked about, and I like to talk about, and that is our little ones. Initially, it was touted from national leadership and probably just early on in the conversation because we didn't know as much about COVID-19 as we now know, that children were almost immune, that they didn't get sick, didn't get as sick. Correct me if I'm wrong, as a parent, if a child has a sniffle or a fever, we're rushing down to, in normal times, to the doctor, what's wrong with my baby? And now we're saying it's okay to let them be exposed. Talk a little bit about why that's important, that children also can get sick, and also the impact that it's having on their education with these hybrid in-school, out-of-school, virtual learning, and their lack of learning, and the deleterious effect it is having, especially on minority children. And let's go with Doctor, and then we'll go to June on that.
Yeah, so I mean, just real quick, initially, like you said, we didn't actually think that children were susceptible to acquiring COVID. And then we realized that we were wrong about that. Again, we're learning so much, but also children can be carriers, vectors. And if they're exposed to, for example, adult teachers, especially adult teachers with comorbidities, diabetes, hypertension, then they actually can be a vector to infect a lot of those teachers. That's why we've had to resort to school at home. But again, there have been ramifications. We'll let June talk about that. But some ramifications are negative in terms of the remote learning and schooling from home.
Okay, excellent. And I want to also bring into this discussion that don't forget, you can add your comments to the chat room, and we want to get to your questions. Don't be afraid to speak up or type up or whatever it takes to get in this conversation. I know there are lots of questions out there. We would love to have this learned panel discuss and answer those issues. So by all means, feel free. We're getting to the last half hour of the program. We would love to have your input. By all means, do that. One of the things we want to talk to, Andrew, you are into business, and you have as I remember from reading your bio, some technical experience, a bit more than most. If you could talk to us about the digital divide. It's one thing of trying to learn, but if you don't have a computer at home, or if your Wi-Fi is too weak, you don't have what you need, you're really behind the 8 ball again when it comes to especially minority children.
Yes. I was supposed to let June answer this question, but hopefully she'll join in because we both have ownership of a company called Mac Installations, which is our sister company to Ellison's. But We are in the process right now of upgrading the Wi-Fi access in about 40 of the CMSD schools. And we have an opportunity to go in those schools and we see some of the kids. And I have to give CMSD credit. They're doing everything they can to close the digital divide. They're sending laptops home to the parents. They're sending Wi-Fi hotspots home. But people may not like this conversation, but I think that the parents need to recognize that we're putting our kids at a tremendous disadvantage by not showing up to remote learning and participating and being diligent about what we're doing and holding ourselves accountable for our kids. Because most kids, if they get a chance to stay home, they think it's a snow day, and they're not going to want to get on the computer. But you have to encourage your kids to do that because the digital divide is tremendous. I've been to some schools where maybe 40% of the kids maybe had access to Wi-Fi, or they don't have a laptop, or in some cases, to be honest, the parents are using the laptop and the kids don't have it. And that's a tragedy to me. So I would encourage us to do better if we can, because we do not want to have our kids left behind by this. And it's important that we all take advantage of what's available to us and not take it for granted.
And June, we're going to come to you very shortly. I wanted to also say, from a parent's perspective, I am the parent, you are the child. This is my house. You do what I say do. You get up, you go to school. You grab that laptop if you have it, you sign on, you do your work. End of discussion. Because if you don't do that, if you're trying to be too much of a friend to your kid's going to fall behind, and the streets would love to get first crack at them. Trust me on that. We all know that to be true. June, now on to you.
Yes, and I think, Harry, what I would just like to add an anecdote to what Mr. Jackson said, which is that this community is a very, very generous community. As Mr. Jackson stated, he cannot name all the people at CMSD and foundations and all that are trying to assist. But I think on the personal responsibility piece, what I encourage our listeners this evening, as well as parents out there, raise your hand and say you need help. Raise your hand and tell this community, what do you need? And I'll just cite two very quick examples. Right now, the state of Ohio and the governor has sent a shipment of masks to Northeastern Ohio. And they've asked this panel tonight to help get the word out that if you are in need of masks, if you're in need of sanitizer, please call. And the number to call is 216-621-0303. Here at the Western Reserve, we can assist. And we know that the hygiene piece, not only for people personally, but in their homes, it's a very expensive proposition. And then when you add that coupled with the number of seniors who are taking care of grandchildren, and the responsibilities of bridging that digital divide during the day, it is enormous. And so we're seeing psychologically families being taxed at a level that has never occurred. But there are counseling resources, there's hygiene resources, there's tutorials as well. This community is ready, willing, and able to help. But people have to be very honest about where they are falling short or in need of assistance or challenged, and say so, and tap the resources that locally Cuyahoga County is providing in terms of food. The state is providing in terms of help with personal protective equipment, and then others are providing in assistance to bridge this digital divide.
You know, June, one of the things that I want to reiterate and sort of make clear, and I think Dr. Maudlin has talked about this, we all have in some degree, and that is the mask, for example. The mask does absolutely no good around your chin. Has to cover your mouth, has to cover your nose, keep your hands out of your eyes, use sanitizer, keep your distance. We've heard this 1,000 times. And if you don't do that kind of stuff, you put yourself and your family at a much greater risk. Dr. Maudlin, if you could expound on that, and then Dell, any thought you may have. And again, let me also encourage people to go to our chat room and put your questions in there or your very brief comments. Dr. Maudlin. Unmute, sir.
Yes, thank you. So the mask actually, and research has shown this, that it predominantly helps protect you from, or actually it helps protect others from you. When you wear a mask, you're actually telling other people that you care about their health. But actually, it's even more effective in terms of the spread, preventing the spread of COVID-19 if both individuals who encounter themselves, who interact and encounter each other, actually are wearing a mask. We felt initially that 6 feet was all that was required, but now actually I've seen some studies 9 feet, 12 feet. It's more dangerous actually when we're indoors compared to outdoors. One reason we're experiencing the resurgence and the spike in the incidence of cases is because we've been driven inside because of the cold weather. One thing I'd like to say also about the children, I think, and there's data and evidence about this, because the children are not going to school. A lot of times outside eyes are not looking in on them. And there've been, and I hate to say it this way, but it's true, there's been a greater incidence of child abuse, neglect, and these sorts of things also, because of the schools are shut down and there's not enough people outside eyes looking on some of these children. So we've seen higher rates of suicide and depression in both children and adults also. The other thing is, we a lot of times we've been just focused on COVID. There are other diseases and medical conditions that people are having that are being ignored. People are having heart attacks and strokes, and their diabetes is not being addressed because the hospitals are inundated. There are not enough beds to treat everybody. And so by wearing a mask, social distancing, hand washing, quarantine oneself, we're actually telling the community that we care about you, so that there will be more hospital beds and availability of healthcare resources to take care of individuals who have serious health conditions other than just COVID-19. So yeah, all this has to be considered. And also, a number of healthcare workers are out sick with COVID as well. So we're starting to be short-staffed in terms of the healthcare providers, doctors, nurses, respiratory therapists, and others. So we actually do have to continue to wear masks. I know there's a lot of COVID fatigue out there. This is a real phenomenon. It's a real disease, and we have to stay the course.
Thank you for that. One of the points that I want to make about that is that during the 1918 pandemic, most of the people who got sick and most of the people who died did so during the second wave of that pandemic, which means exactly what Dr. Maudlin was just talking about, COVID-19 or pandemic fatigue. We get tired of washing our hands, tired of keeping the social distance, tired of wearing the mask. We get tired, and then we get infected, and then we die, or we spread it to somebody else. Dale Edwards, your thoughts on all of this?
What I like to say is we progress and we get people vaccinated and everything. What we got to understand is that there's a study that came out of New York that shows that there's a lack of proper tech resources at home is a problem that disproportionately affects low-income families. And if these kids continue to stay off and don't resume in-person learning, that probably they're going to lose approximately 10 months of learning. They're going to be that far behind. The gap is just going to widen. And you can correct me if I'm wrong, but I've been saying this for the last 4 or 5 months, that what I'd like to see CMSD do, I'd like to see the city of Cleveland do it, and that is put instead of sending a hotspot home, I like to see them put Wi-Fi across the community.
Broadband.
You know, I don't know what the cost would be, but I know that they've implemented it in the area of Tremont, you know, and it's worked real fine. So I think that we really, you know, if it's been done, correct me, but I mean, I just think that needs to be occurring. And then we need to do just what you said, Andrew. We need to take the responsibility and get our kids educated.
You know, there's a saying that power concedes nothing without a demand. It never has, and it never will. That means we have to demand from our leaders to spend our tax dollars where we want them to be spent. And if it means getting Wi-Fi for the whole community, then we have to demand that. Everything that we have fought for as a people, we've gotten when we fought for it. when we sat back and asked for it, it hasn't always happened. Andrew, let's talk a little bit about you and the whole business thing, because I know that that poses a particular threat to business, COVID-19, and making sure people can come to work and how they get to work and making sure they're safe when they do come to work. You touched on it a little bit earlier, but we have people coming into this conversation all the time, and I'd like to revisit that with you. And again, if I could invite people to remember to go to our chat room, put your questions in, put in your brief comments. We'll try to ask and answer as many of those as possible. Andrew Jackson.
Yeah, I want to make another comment though about what, and I'll get them out. I'll keep my comments short because I know time is running short. But I do want to say to what Dale Edwards said about Dr. Maudlin. He has been a stalwart in this community for this effort. He's been at it for 12 years, and he's beaten the pavement for people to be proactive. And the things that he's given us in our community are important. I mean, free EKG, diabetes testing, high blood pressure testing, things of that nature. I'm an executive program at Cleveland Clinic, and that stuff is expensive, and he's giving it away. And my point to us is that we can't want more for you than you want for yourself. And so you have to embrace the things that he's providing, because if you had to pay for that stuff through insurance or personal, it would be very expensive. And so that gets to your point that you're asking about, Harry. It's about people coming to work. Many people are riding public transportation to work. I'm on the bus route. Our employees may or may not have a vehicle to drive, and so they have to catch the bus from the south side of town to get to the north side of town, because we're in the Collinwood area. And I often worry about even the guys getting on the buses and the buses being clean and that being sanitary. And so we have to ask for it. We have to demand that we get treated right, because often the minority employee is the one who's on the front line. People can work from home if you have a job that allows you to work from home. But many of our workers in our community are minorities, and they don't have the opportunity or the choice to work at home. They have to run the machines. They have to man the machines. They have to pick up the materials, to move the materials, or they're in construction. So it affects us more, and we have to be more cognizant of what we need to be safe. And we have to blow the horn for our people to make sure they're safe.
Thank you for that. Dr. Maudlin, I want to briefly go back to you, and then June, I promise to get you into this very shortly. And I want to talk about this idea of herd immunity. It seems to be the national position that if everybody gets infected, 70, 80%, then we got this herd immunity. Explain to us what herd immunity is. And secondly, I want to ask, does it really exist and does it really work? The common cold is a coronavirus. We get colds every year. A flu, a coronavirus. We get the flu every year. So does herd immunity really exist, and can we count on that to keep ourselves and our families alive? Dr. Maudlin.
Yeah, so the terminology really it's an agricultural terminology that actually it's a real phenomenon. It actually really works. And the NIH and CDC has actually recommended that if 70% of the individuals in the country actually receives the vaccine and develops antibodies, we will acquire this quote unquote herd immunity situation. It's where the majority of the population actually has antibodies, and then eventually the virus will die out because it won't have any place vector in which to go. Won't have any humans to further infect, and so that is the goal. Again, I don't know that we are actually going to get to that situation, by vaccination. That's one of the reasons why we're trying to encourage people actually to take the vaccination. So yeah, it is a real phenomenon, and actually it is a goal that we have to get at least 70% of the individuals immunized.
Okay, thank you for that. June, I'm going to read from the comments and answer this as best you can. Anybody else who feels they need to jump into this, feel free to do that. It says, in the same way that the killing of George Floyd in Minneapolis made plain how this country has never truly dealt with its history of systematic racism in policing, the COVID-19 pandemic has made plain the unaddressed history of distrust and systematic racism in the nation's healthcare system. That's probably one that Dr. Maudlin can get into, but I want to get your thoughts on that too. And then Dr. Maudlin, we'd have you follow up, if you will. June, just your basic.
Yes, to answer that question, there's now another side of this, which is there are area agencies on aging that partner with the healthcare systems. And by having that sort of brother-sister approach, I think what you'll find out there is that there are agencies and healthcare partners of which the community does trust. And because they trust them, they contact them, they ask them to help them with their specific needs, and they deliver. We report to, just as ours agency, for example, we report to the state, and those metrics are measured. So I think Mr. Allen's question is spot on, and I think that part of the answer is to look at the healthcare agency partners and their track record of trust, which I believe in 2020 and beyond is exhibited and is going to be relevant going forward.
Dr. Maudlin, I'm coming to you next, and I would also like to have you, as a part of your answer this question from Meltrice Sharp. What are some of the known side effects of the vaccine? And also, is there anything you can do at the onset of symptoms that will help reduce the overall effects of COVID-19?
Yeah, so just like when you get the annual flu vaccine, you can actually pre-medicate yourself with Tylenol just to help damper some of the mild side effects that you may get. Actually, there was an article that came out today that, and they saw this in the European vaccination that actually started, I think it was about a week or two ago. Some of the mild side effects are low-grade fever, myalgias, muscle pain, pain at the injection site. But the recommendation is had a severe anaphylaxis or severe reaction to a
Dr. Maudlin, we have a problem technically with your with your discussion. So we're going to come back to you. It'll probably sync up again very shortly. I want to just let everybody know, and thank you very much for tuning into the Black Professionals Association Charitable Foundation's Part 2 about COVID-19. For almost the last hour and 15 minutes, we've been talking about this issue that is so important to this community. Folks can stay alive and they can die depending upon what you do and what you believe. And we're trying to inform you, or to at least impress upon you, how important it is to be your own best advocate. And we have some very important people to do that. We have Andrew Jackson, who's here. We have Dale Edwards here. We have June Edwards, who is here, and Dr. Maudlin from the Cleveland Clinic, who will also be joining us back in just a little bit. I want to also ask a little bit about this special task force that both Andrew Jackson and June a part of. Talk to us some more from your perspective. Dr. Maudlin talked about it briefly, but from your perspective, what did you get out of it, and what are you bringing back to the community in regards to the governor's special task force on minorities when it comes to COVID-19? And June, let's start with you.
Yeah.
Great. I chaired the resources committee, and I'll tell you what the governor's goal was. The goal was to assimilate resources so that COVID-19 could be fought by all geographic areas of this state very fiercely. So, for example, the resources that you now see deployed in not just Cleveland, but Toledo and Cincinnati and Dayton and Columbus with regard to testing. That was a result of this task force. Next, right now, the governor has shipped approximately, I believe, 400,000 masks to Northeastern Ohio, and is making sure that we disseminate those. So the task force has made sure that resources are available to the citizens, and that's key.
All right, thank you very much for that. Let me go back to another of the questions that I saw here, or comments over in the comment section here. And this is from, it looks like Jamil Carr. We may have already talked about this, but again, different people are tuning in at different times and they may have missed the comment. Well, before I do that, let me go to Andrew Jackson so you can comment, if you will, on the governor's task force that you were part of.
Yes, I was on the committee. I was on the healthcare subcommittee. And one of the things that the governor emphasized was that your area code should not determine whether you live or die from COVID-19. And so my committee focused on two things. How to prevent African Americans and minorities from getting the disease if we can, by doing all the things that the COVID-19 committee recommended. But our real focus was on when you get it and you go to the hospital, how do you get treated? Do they tell you to take an aspirin and a Tylenol and some Gatorade and go kick it back? Whereas if your counterpart goes who has healthcare and all those great things going for them, they get a chance to get a respirator. So we were trying to close that social economic divide between the haves and the have-nots on the healthcare committee and make sure that we get treated right and don't get treated in a disparate way when we get to the healthcare facility to support us. And so that was our main focus. And I do commend the governor for saying that that was very important and recognize that that could be an issue and a challenge for minorities with COVID-19.
And that is important. All of us can't get a helicopter ride over to a hospital and a limousine ride over there and cost $100,000 to get steroids like some of the country have. It should be available to all of us, but the reality is it is not. And we have to push for that kind of treatment if we want that kind of treatment. It's not guaranteed we'll get it, but if we don't ask for it, chances are, my mom says, you have not because you ask not. Let me go to Dr. Maudlin again and just talk a little bit more about what we should be thinking about. There's a question here, and I hope I'm going to pronounce her last name correctly. Christine Zeppi says, should physicians see patients who have not been tested for COVID? If so, what protection do you suggest? And this again for Dr. Maudlin.
Yeah, so thank you. Sorry about the internet disconnection. We actually require all patients who are coming in for elective procedures, actually even emergency procedures, coming into the hospital to be tested for COVID. We don't necessarily require that everybody coming for a regular clinic visit be tested, although we ask them questions at the door, whether or not they have any fever, exposure to COVID, or any symptoms. Again, we don't actually have enough reagents to test everybody. It would be prohibitive. It would take a number of days to get some of these COVID tests back. And even though they're a rapid test, and we still have to treat people in need that have other serious medical conditions. So to date, no, we're not testing every single patient that comes to the door for COVID.
I'm still here. Just had to unmute. I try not to have to clear my throat every now and again, so I mute so you won't hear all that, on this call. And we thank everybody who is watching and listening and participating in this discussion. It is important. We're getting close to the end of this program, and I want to give each of you at least a couple of minutes to sort of give us your final thoughts on this whole issue that we've been talking about, COVID-19, the coronavirus, and how it's killing us and how we have some personal responsibility, and about the vaccine and the kinds of things that we can do to ward this disease off as best we can. There are no guarantees, but then we know there are no guarantees in life. So Minister Dale Edwards, we'll start with you. We'll do a round robin discussion and your final thoughts around this issue. Minister Edwards, you've got the floor.
Thank you, Harry. First off, I'd like to thank God for the mercy and the grace that he has bestowed upon me and my family. I'd like to thank the Black Professionals Association Charitable Foundation, you, Harry, and then you, June, and Andrew, and Dr. Maudlin for allowing me to take part in this very important discussion. I believe that it's going to take people like Dr. Maudlin and each and every one of you that the community trusts, that they can get the information and believe in each and everything that we've said here to validate the fact that they need to take this vaccine. We can ill afford to be the last ones on the line to be treated. We need to be the first in line to be treated. It's so many things that are associated with this disease that we don't know and we will not know. But the one thing we know that it does kill. and we have to take action, and we have to take responsible action. So again, vet the information. That means that you need to review it. You need to get all of the facts and then act. Again, thank you for allowing me to be a part of this forum, and I look forward to many more forums.
Thank you, Minister Dale
Edwards.
We appreciate all that you do and have done in this community for the decades that you've been a servant leader in this community. And I can't tell you, like I couldn't for the November 3rd election, for whom to vote. I won't tell you, go get the vaccine, but for me and mine, I'm going to be stuck in my arm as soon as is humanly possible. June Taylor, you're.
Let me say one more thing, Harry. I'd like to thank the Call and Post newspaper for giving me a platform to speak from. Thank you, and thank you to all of the stakeholders there.
Thank you. June Taylor, on you.
Yes, thank you so much. I really appreciate this opportunity, and I'd like to also thank the Black Professional Organization. I also see this as a wonderful opportunity for the community. And for the questions that were also asked about ventilation, I will respond by saying it is not the air flow, it's the air quality. And I think Dr. Maudlin would probably second the motion on that. That is really key. And so having that air filter, some individuals are also prescribing to having oil diffusers in the home as well. And also having the portable filters. Those portable filters will be of great assistance as well. My final comment is that I really implore upon everyone, take responsibility for your actions. We know what the high risk behaviors are. We know what the low risk behaviors are. I know that this has been an issue also about personal freedom, but we are really trying to make a sacrifice now so that we can have a better life afterwards. And so I really encourage people to be serious about this and do not at all endanger the lives of others. I think that it is so selfish for so many people to take the position that they have about not wearing masks and not being diligent about hygiene during this time. So that's what I would really leave as my final comments, that it's not about each individual now, it's about us collectively sacrificing for us all. Thank you.
I hear you. It's not about me, it's about we. We all have to individually and collectively take responsibility, because our actions really will determine whether or not we get sick, live, or die, and how well we live if we do not die. Andrew, Jack, your closing thoughts.
First, I want to thank Harry for being a great moderator. Oftentimes, a moderator wants to jump in, but you did a good job. And the lady behind the scenes, Karen Marshall, she's been behind the scenes. She's helped us support us also. Thanks. But my statement to you is practice personal responsibility. It's been said already. But if you don't do it for yourself, do it for your kids and your other family members and your parents and your aunts and uncles who are going to be around when you're gone. And imagine the pain that they will have if you're not practicing personal responsibility and taking care of yourself.
Thank you for that. You know, many of us made the bad decision to get together for Thanksgiving, to travel from city to city, state to state, go to Big Mama's house, and we may have spread the coronavirus. The Christmas holiday is coming up. I urge all of us not to make that same mistake. You may have gotten through this one, but you may not get through the next one. Do all you can do. Dr. Maudlin, on you, your closing thoughts, sir.
Yeah, thanks. I'd like to thank the BPA-CF, Karen Marshall, Harry, the panelists. This has been a critically important discussion that we've had. There's actually a debate now as in terms of whether, and this is an article, I don't know if you can see it, should people of color get access to the COVID-19 vaccine before others? And I was really surprised that this is an example. For the first time, African Americans are it's proposed by even Melinda Gates that African Americans get to go to the front of the line. But this article talks about how many African Americans, other minorities, are saying they're saying no, we don't want to be the first to try this vaccine because we don't want to be guinea pigs. The reason why it's suggested that we should be at the front of the line is because we have a greater susceptibility to dying from COVID. I mean, the data are stark. The data are clear. So I appreciate this BPACF forum because all of your listeners, those individuals associated with the Black Professional Charitable Foundation, are influencers. We all have the ability to influence our networks and to encourage them to receive information, like Andrew said, learn about the vaccine, make the decision for yourself. But I would actually encourage you to take the vaccine. I myself am willing to take the vaccine, as are the other panelists and many other influential individuals. So thank you again for allowing me to speak during this panel and for having this forum.
Dr. Maudlin, your voice is among the most important in this community, and I think we should be listening to you and Dr. Fauci from a national perspective. If you guys say it's okay by me. I'm telling you, as soon as I can, I will. I want to live. No guarantee, but I'm going to get mine. I encourage you to do what you feel is necessary for you. But, hey, I'm not waiting. I know that COVID-19 is a killer, and it's going to have to run me down. All right. And I may not be as young as I used to be, but I can still pick them up and put them down when I need to. I can put off that shirt and get that stick in the arm, at least will increase my possibility of surviving. And at the very least, if I do get it, and Dr. Maudlin, I know you can attest to this, it should be less severe if I get that vaccine. So let me just do some housekeeping here. First of all, thanks to all of you, Andrew Jackson, June Taylor, Minister Dale Edwards, Dr. Charles Maudlin, Karen Marshall, for all that you've done. As we wrap up, and I'm going to do some housekeeping, that means I got to read to be specific. As we wrap up our panel presentation, I want to recognize and thank the BPACF corporate partner, Avery Dennison, for sponsoring the Professional Development Leadership Series for 2020. The mission of the Black Professional Association Charitable Foundation, BPACF, is to create opportunities for African American professionals by providing scholarship, leadership, professional, and career development. BPACF's vision is to be a catalyst that prepares and develops professionals, celebrates distinguished leaders, and elevate Greater Cleveland's Black community. To date, BPACF has allocated over $3.5 million in scholarships, which is primarily raised through the BPACF Signature Fundraiser, the annual Scholarship and Awards Gala, and the Black Professional of the Year Salute, which BPACF recently celebrated its 40th anniversary, November 14th. Visit bpacf.org for more information and connect with BPACF on most social media sites. Wow, 40 years of serving the Black community. Come on, let's donate and get this organization what it needs. That is the support that it needs. My thanks again to all of you. For those of you who have been listening and watching, I appreciate what you have been doing. And I want to say in closing, thank you so very much to all of you. And keep in mind, this is within our power to determine if we live or die. We cannot and should not be blaming somebody else. It is up to you and me if it is to be. And I want to again thank the Black Professionals Association Charitable Foundation. I'm Harry Boomer. Be well, everybody, and please take good care. Bye-bye and God.